Namaste. Welcome to another episode of Nutrition Talks Heart to Heart. I am Annapurna and today's topic is about pregnant women and their water intake. During pregnancy, there is a lot of physiological changes that are taking place in the body. That is, there is an increase in the blood volume, there is a slight increase in the kidneys, the renal plasma flow increases, the glomerular filtration rate increases. So all this leads to an extra intake of water, extra requirement of water. And all this is because she requires more energy. When she requires more energy, the intake of food increases. And therefore this increases the metabolism. So more water is required for the metabolism, for the digestion to take place, for the absorption and for also the excretion of the wastes. So all this is very closely related. More energy required, more food intake and more water requirement. Adequate water intake during pregnancy will help in the removal of waste from the body. And this will lower the risk of urinary tract infections and other infections during pregnancy. Because of the hormonal changes during pregnancy, a pregnant woman usually faces the problem of constipation. And adequate water intake will also relieve this constipation. The stools will be softened and there will be a better and easy movement of bowels. So better hydration is required not only to relieve the constipation but also to prevent the formation of hemorrhoids also during pregnancy. Signs of dehydration. The first and foremost sign of dehydration is thirst. A pregnant woman can feel thirsty, she can feel hungry, or she can feel both thirsty and hungry also. This is the best method to know that she needs more water. She needs to take in more fluid. And the second most important sign of dehydration is the changes in urine. Usually the color of urine is a pale yellow color. When the color changes to a darker shade, it is a sure sign of dehydration taking place. And there are other signs like feeling weak, fatigue, dizziness, headache, which also suggests that there is dehydration taking place. And another important sign is dry skin. When dehydration is there could be a lot of itchiness, especially on the stomach of a pregnant woman. So as it is, the itchiness is there, and with dehydration the itchiness increases. And these are all the signs which will suggest that the intake of water should be increased. How to stay hydrated during pregnancy? Start the day by drinking a warm glass of water. This is the best habit that one can develop. So as to start the day by getting hydrated and also staying hydrated throughout the day. And the best way is to sip water every time. And keeping a bottle of water beside, and that will be an indication that will tell us how much of water we are taking in. So a pregnant woman can always keep a bottle of water beside her and keep sipping water little by little. That is the best way to hydrate herself. Other than drinking plain water, she can also consume herbal teas or flavored teas like with a dash of lemon, or a few swigs of mint leaves or basil leaves. This type of flavored and herbal teas will help her to consume also more water. And there are other ways like drinking soups, smoothies, fruit juices. By consuming smoothies, fruit juices or soups, the nutrient content intake also will be increased. But in some cases the pregnant women might fear that the salt intake or the sugar intake increases because of smoothies or juices or soups. So in that case, they should be consumed in moderation. And there are other ways to also increase the water intake. The seasonally and locally available fruits and vegetables are really great sources of water. Especially fruits like watermelon, muskmelon, grapes, all these are very good sources of water, and by consuming all these seasonally and locally available vegetables and fruits increases both the water content and also relieves the constipation which is faced by the pregnant woman.